Thank you, Rory and panel. That was a compelling conversation on scientific advances and human adoption. And also a good reminder that it's not always about the hardware. The call for reorganizing the system, we've been talking about things that have echoed over the course of the decade. It's something that, sounds familiar. Maybe the robots will have some ideas for how to generate the political will to actually do that. But back to the human side, our next topic couldn't be more urgent. Across Europe, young people are facing a silent epidemic of anxiety, isolation, and burnout. Many of the causes are digital: social media, digital overexposure, and online bullying. This next session, Youth Mental Health in the Digital Age, asks how we can move beyond awareness to real action. Please welcome our moderator, Claudia Chiappa, Politico's health reporter, and speakers as they join the stage.
Good morning, everyone. This is our last session of the morning. I'm Claudia Chiappa, I'm a healthcare reporter, here joined on stage for our session on youth mental health in a digital era by three great panelists, and we have one also panelist online for this session. So welcome me in joining, join me in welcoming Francesca Colombo from the OECD, head of the health division, Kadri Sova, director of Mental Health Europe, Stefan Schrack, advisor for stakeholder relations at DG Sante. And online, we have Frank Bellivier, ministerial delegate for mental and psychiatric health at the Ministry of Health of France. So we have all seen recently the numbers when it comes to young people and mental health, and they're quite concerning. According to WHO, an estimated 1 in 7 children and adolescents in the European region has a mental health condition. And suicide is the leading cause of death among young people between 15 and 29. Countries and public health experts are trying to find a solution to this growing problem. And one of the items and tools that they're looking at, as if not the cause, at least an exacerbating factor, is social media and the internet. Time young people are spending online is growing, and the WHO has also found that teenagers are growingly showing signs of problematic use of social media. So this is the situation we're in today, and we're going to talk about, hopefully, what are some of the solutions and the ways that the EU and countries and public health experts can move forward to tackle this problem. So I would like to start with Francesca. Can you, help us paint a picture of what we're seeing in Europe when we're talking about young people and mental health? How has the situation evolved since COVID, and what does it look like today?
Okay, well, I'll talk since COVID, but I think it's better to look even what happened before COVID, because one of the first message is that the decline in mental health of young people actually preceded COVID. And that's what we see from data which are both national level data sets as well as international surveys. So national level data sets, to be frank, there are not too many countries that have representative time series on youth mental health, but there are a few. And the OECD would look at about 11 countries, look at data over the past 20 years. And for those 11 countries, out of those 11 countries, 9 showed a decline in mental health, so a worsening of condition linked to depression, anxieties, and so forth. Less so on more severe mental health issues like bipolar disorder or schizophrenia, but definitely a decline in more milder mental health condition of youth. So this is 20 years, so it predates COVID. If we look at surveys which are done internationally, like health behavior of children in school children, we see also that there has been in decline in the past, for example, 8 years, looking at things like the mental well-being children. And similarly, when we take indicators like hospitalization for self-harm, which are some indicators that we collect at OECD for the countries for which data is available in the past 7 years or so, we see an increase, particularly in women, in girls, about 39% increase in hospitalization for self-harm. So that's the overarching panorama. I mean, things got worse during the COVID-19 pandemic, an increase between, depending on countries, between 10 and 30% in mood disorders or depressions and things like that. And things have got a little bit better since COVID-19, but going back to that pre-existing decline that we have seen over a longer time period than just the COVID-19 pandemic. So I think it's quite important, and it's different from what we see for adults, where yes, there's a worsening in mental health, but it's much more difficult to see whether there is really a trend. There are more conflicting data, where for youth, we really see a pattern which is consistent over time, and that predates COVID-19.
What do we know in terms of the causes behind? Is there much research, or there are still big gaps? Or how, for example, can we talk about social media and the effect that that's having?
There are multiple causes. Of course, there is a lot of attention on digitalization, social media, and so forth, but there are both, in a way, some old determinants as well as some new determinants. So all determinants includes anxiety about the economic situations, school pressure, bullying, although obviously digitalization might exacerbate and make bigger the bullying with cyberbullying. But there are some old determinants which exist, and they are there, and they should not be forgotten. On top of that, there are some new determinants, so climate anxieties and impact of digitalization as well. Again, it's difficult to really see, what digitalization, to what extent digitalization really worsened the mental health of young people. Because on the one hand, there are a lot of young people that get access to mental health support through digital tools and support systems. But there is an evidence that excessive social media use, a lot of use of digital and social media before going to sleep, for example, definitely affects sleeping patterns, or issues like exposure to harmful content. So content that is really going to be distressful for young people, that there is definitely some evidence of a negative impact on the mental health. Again, there are also some positive things with digitalizations and even with social media in terms of the support that some young people get through those means. Yeah.
Yes, definitely. I think it's been proven for socialization. It also has some positive aspect, but there is, I think, an increased focus on the negative effects. And I would like to turn to Stefan to talk about this a little bit, because I think this is growing more and more on top of the EU's agenda. Ursula von der Leyen has spoken about this quite extensively over the past year at her State of the Union address. She announced an EU inquiry in the impacts of social media on young people's mental health and well-being, and also mentioned that she was gathering a panel of experts to advise on best approaches. So I wanted to come to you, to the Commission, to hear, first off, how these initiatives are going, if you can give us an update, and anything else that the Commission is doing to kind of get a better sense of how much this is a problem and then what we can do about it.
Indeed, it is a big problem, and it is a growing problem, like Francesca pointed out. Yes, and we have social media now, and we have the pandemic. But maybe I should start with saying that this was recognized as a problem already 20 years ago. This is when we started working on mental health, actually, already. And the latest important developments there would start with the initiative which we launched in 2023, where we issued a communication on mental health announcing 20 flagship actions which are in the process of being implemented, which already had a focus on young people. And of course now, with the latest announcement, indeed, we complement this by two initiatives. There's one which is supposed to provide rapid results already, which is focused on age restrictions for social services. There will be a panel of experts meeting a couple of times, and the results are expected very soon. And there's the inquiry you were mentioning. The time span is a bit longer. We think about maybe that will be available end of next year, 2026. And that is a wider consideration of the health impacts of social media on young people, and also looking at excessive screen time, and will hopefully also come up with more general recommendations then. So in particular, we are interested in having a good scientific evidence base for what then is proposed as a follow-up. Yeah, so that's more or less where we are at the moment in terms of procedure. I should also say that we are not doing all of this in isolation as a commission. We are always working with civil society. Yeah, the Mental Health Europe, for example, was in the lead in designing the 2023 list of actions. And that is very interesting, how closely we work with civil society in that area. And we work also with OECD, of course. OECD is doing an analysis of data for us, also to provide more evidence for decisions to be made. And I would also like to mention that we are working with member states. Yeah, we have also member states on the table here. We have a public health expert group with a subgroup on mental health, and we are discussing everything with them before it's actually proposed. Because you know our specific role, the role of the European Union in the area of public health is a bit limited. Member states are in charge fully 100% of how they organize their health systems. And that is something we need to respect, and that's why we discuss any sort of activity or prioritization with this subgroup on mental health first. Yes, so, and we are also working with WHO, by the way. So we are just trying to make use of everybody's expertise here to come up in this complicated field with recommendations that really make sense and can be implemented. Yes, if you allow me a further minute. One of our instruments these days is also the use of best practices, because we learned that member states, they prefer implementing new approaches which have already been successfully tested in other member states in real life situations, rather than just implementing policy papers which are established by experts. And we made a specific call for best practices for the implementation of this 2023 initiative, which came up with 29 new best practices, which are in our best practice portal and which are now available for member states that would like to implement them. And what we usually do is also to support this implementation by a specific instrument under the EU for Health program, which is called Joint Actions, which basically means it is money that goes to governments and authorities for implementing certain policy aims, in this case then the implementation of best practices on their territory. Sorry for speaking too much.
No, this is great, thank you. It gives us an idea of the various ways that the Commission is tackling this. And can I actually stay with you a little bit longer, because I would love to follow up a bit on both the panel of experts and social media inquiry. So on the panel of experts, can you give us maybe an idea of what kind of experts you're gathering for this panel? And you said it's going to come up with recommendation for age restriction. Does that mean you're going to come up with, for example, what's the age that we should restrict social media? What exactly? And then on the inquiry, what stage are we in right now for that? I know you said it's coming out end of next year, so we're still in the kind of gathering evidence kind of stage.
Yes, well, we are talking about two different processes here. There's a shorter one on the age restrictions, and a longer one which looks more widely at the health consequences. And well, the shorter panel is actually under the control of our colleagues in DG Connect, so I can't say a lot about how this is done. And for the overall inquiry, it is obvious that what we need is experts from all the relevant fields. So obviously we need experts who know the logic behind the providers of social media, and experts which are able to assess the consequences for the children. But of course also experts from other fields, because this concerns also education, for example. So we do it like we do it also in other fields. We try to really have a multidisciplinary team of experts, which is able to provide recommendations which cover the perspectives of all the necessary specialties here.
Okay, thank you. Frank, if you can hear us, I would like to move to you a little bit to hear about from the national approach. So France has been quite a strong advocate in this field in calling for a social media ban, rallying countries around stronger restrictions. Can you tell us about what is happening at the national level, what the discourse is like, and what initiatives the government is exploring and taking to help protect the young people?
Okay, first of all, thank you for the invitation. So, about the French situation, I first should say that our observations are really consistent with many aspects that has been previously mentioned during this panel, and in particular the fact that the mental health decline in young people has clearly preceded the COVID crisis. However, what happened during the COVID crisis and on the years following the COVID crisis, there are lessons on to better understand what happened in young people. And in the French roadmap for mental health and psychiatry, there is a component as a priority for mental health of young people. And there is quite early we identified the digital tools as an issue. So recently, President Macron called for a conference and created a a commission to investigate what can be done on this topic. And he asked for the creation of a French roadmap on digital tools. And the work is ongoing, but we already have identified very concrete determinants to act on. Sleep is really critical, and we know that disruption of circadian rhythm related to high exposure to screens is circadian disruption is a strong determinant of mental health problem, anxiety, depression, and suicidal thoughts. Another determinant connected with the overuse of screens is diet, and it's also a determinant on which we can act on. And of course, it has already been mentioned, the regulation of the content of the social media, but not only the social media, with a better control of the stressful content to which the young people are exposed. Another critical question is, again, to set up concrete actions, is whether how we should tailor and how we should design intervention toward kids, parents, but also schools. So that's another important aspect for concrete action on to adapt the kids and adolescents to this modern reality, to use screen for almost everything. And the last challenge is to coordinate this roadmap on digital tools with other roadmaps, because we also have a recently launched roadmap on sleep problems, because all indicators of sleep problems are not only related to the use of screens. coordination also with the more general reform plans we have. And this is a reference to the mental health and psychiatric roadmap I am in charge in at the Ministry of Health. And we also have a plan of reforms, a general plan of reforms from child and adolescent health in general. So it's a combination of these actions plans that we are working on at this very moment.
Thank you, Frank. And also, yeah, thank you for pointing out that this is a conversation that also involves teachers, parents, and the education. We'll get more into that later. I will now turn to Kadri. So we've heard, some of what the data is. We've heard from some of the commission's actions, some at the national level. From your perspective and as a civil society, what do you think in terms of when talking about measures would be most effective? Is there enough sense of urgency when we're talking about this problem? And how do we move faster? Because there is still a lot, I think, a conversation about assessing the problem, but I think there is also real need for also action.
Yeah, thanks very much. I do get the sense of urgency, and it is extremely urgent. I mean, we heard the statistics also about suicide and anxiety and depression, but mental health is very complex, and I understand the need for quick fixes, and I think that's why there's a lot of willingness to pin everything on social media, and then we can regulate the social media, and then the problem will be gone. But it's just part of the problem, and it's also, I think we shouldn't talk about how do we fix the problems or the individual issues of young people, but what's the environment around them that has changed in these 20 years, and what has made this environment unsafe? So for sure, digital environments are really, really important to look at. I mean, the persuasive design features that really maximize the engagement in detriment to well-being. There's also, the harmful content, the algorithmic sort of maximization of harmful content and the social comparison, huge issues, and we need to tackle that. And I think that the sort of very helpful way to look at it is from this product design and safety perspective, because we're used to looking at health and safety of different products. Like when it's about children, it's about toys, are they safe, food safety. But digital products are also products that are being sold to us, and how to actually measure and assess the psychological safety, because that's also part of health. Mental health is also health. So I think that's definitely a really important way to go forward. But I want to also emphasize what has been said before. We shouldn't look at this in isolation, and there is also, it is difficult also to make the causal sort of connection between negative mental health outcomes and digital environments. It's hard to do that, but there is research showing that children who are in vulnerable situations are much more or disproportionately experiencing negative impacts from social media and digital environments. So that's where the socioeconomic determinants are so important, and looking at what is the context around the young people, and also, are their parents okay? What's their school environment like? Teachers in burnout. There's so many different things that actually impact. So yeah, pinning it just down on one single thing is not helpful.
So looking, yes, definitely at the entire kind of environment of the children and young people. And when we're talking about solution, obviously we already tackled a lot of possible ones. Now, Kadri, you mentioned looking at the design features. So do you think then there should be more regulation, on the company side, on the industry side, when they're designing this product? Is it a shared responsibility?
Yeah, I feel like with the responsibility, we really have to look at it like in a hierarchical way, because those that hold more power have more responsibility. I think that should really be the bottom line at this as well. So when we talk about the responsibilities, then those who are designing these products should hold the most responsibility. At the second place, it's the policymakers. So we need policymakers to take decisive action. And only after that we have, schools, the digital literacy side of it, and then parents, and then young people themselves. I think it's just it makes me so upset to actually put the onus on the children and ask them to unplug from something that has been specifically designed to keep them hooked. Like, how can we ask that? And any parents in the room, I'm sure you feel the solidarity. I have a 12-year-old and I'm trying to do that and have those conversations, trying to moderate the screen time. It's hard, like it's like a second job. So yeah, I feel like we really got to look at the power. But there is good progress. I think there is momentum also at EU level. There's the digital fairness framework that really looks at these dark patterns and the product safety, from a product safety perspective. We're also working with Mental Health Europe with the EU market surveillance authorities, and they are starting to look at like the psychological side of product safety. So that's all very exciting. But I think there are just so many different components that have to work together. And that's why Stefan mentioned, the comprehensive approach to mental health. But this will run its course in 2026. And so what's then? We need a strategy, like we need a mental health strategy that actually ties everything together and has that kind of overarching view. Otherwise, it's just going to be bits and pieces here and there. So yeah.
I think, this mirrors a lot of conversation that we're having in other panels about food, about tobacco, about other products, where should the responsibility be on the person consuming it, whether, also on the companies and the industry. I think Stefan wants to respond to.
Yes, just complementing what was just said. Maybe this is the one I should mention, that there's also the Digital Services Act, DSA, which for the so-called very large online platforms and search engines, that means more than 45 million users per month, they are obliged to regularly assess and mitigate systemic risks that arise from the design, features and use of their services, including possible negative effects on mental and physical well-being of users. So that obligation is actually already there. So I just wanted to mention it here for completeness.
But do you think if the obligation is there, but we still see problems, is there a problem in the implementation? And where is it then if it's not, I guess, enough?
Yeah, this is of course all very new, and we will see how this develops. But it is clear that the Commission services in charge of that will look very closely at the development and see how effective it actually is, and then amend it as necessary and change course.
Thank you.
No, just wanted to stress the issues, obviously, that we need to have a package of different policy approaches. It's not just by having regulation of product safety. We need to look at the determinants. We need to look then at the support for people who have mental health issues. We need to look at the role of education, making sure that we teach young people to have social, emotional skills as they grow up. We need to make services much more readily available, comprehensive, holistic, being free to also have access to having peer supports and so forth. So clearly we need all of these things together. It's just relying only on one solutions will not get us there, because of the complexity of the multiple determinants. We're doing actually also some work. It's not published yet. It's going to be next year, but they try to measure also the cost effectiveness of different type of interventions. And without coming up with all the results right now, but one thing that is really clearly coming up is that there are a number of services in the health sector or approaches in the health sector which are actually cost effective. But the results at population level remain relatively limited, and it points to really the reinforcing population level impact that you have by having much more integrated approach that cut across the health, the educations and so forth. So this comes just from the analysis. Initially we're looking like, okay, yeah, cost effective, but actually we're not going to address the tide here. We're not really going to change, and is really because it's only once you implement the sets of various different approaches and policies that you can have a little bit more of a volume of impact, if you want. So it's so just wanted to add to that. That of course does not, what you mentioned, it's absolutely fundamental. But I think we always need to think about in this integrated approach and what are the different solutions. And we also need to evaluate much more the impacts of policies which are put in place. There bans, school bans at the moment, or there are also like the implementation of age limits for social media. We really need to have good evaluations of the impact of these policies so this impact evaluation actually when again, the analysis that we've been doing, and to model cost effectiveness, we need to understand the effectiveness first. So we need to have those, thorough evaluations of the impact of policies to then really be able to understand, where we get the best results for the resources that we have as well.
Yeah, understanding what works best. Really quick also for the audience as a reminder, we will have a Q&A towards the last 5-10 minutes of the session. So if you want to start thinking about your questions, feel free. But yes, Stefan.
Yes, at this stage, what I would like to add is also that this is not just theoretical, what Francesca just was saying. We will stay in constant dialogue with member states in the subgroup of mental health, which actually means they will have opportunities to explain what they do. And what Franck was saying is very interesting, what France is now doing. And everybody, in other words, all the other 27 will be interested in how that goes and what the results are to draw conclusions from them for themselves. So we hope we will have a very productive discussion in the mental health subgroup among the member states, which will also help to clarify the Commission's ideas about the next steps. And we know from other areas that this is a very useful kind of dialogue.
Yes, and on this actually, I would like to go back to Frank a bit, because I think what we're seeing is that once a country usually starts with some kind of restriction or gets a little bit brave, others are like more likely to follow suit. So France, for example, one thing is that this social media ban, the discussion around it has really, I think, taken hold in Brussels in the past year, and countries are exploring whether this is a solution. I think, like Francesca pointed out, it's hard to know because you need to assess whether then they actually work, these bans, and there is, I think, still a lot of disagreement on how it would even look like. Would it be a ban at the national level? Could it be possible to have it at the EU level? Would it just require parent permission? Would it actually completely ban children from accessing social media? So Frank, can you tell us, from your point of view and what France thinks about this, do you see this as a key part of the solution? Could it be one way to actually help in the situation? And what is the role that the EU could play into this? Or do you think it would be best to have this at the national level?
Okay, actually we are focusing on how to train parents and schools to adapt and to help kids and adolescents to adapt to this new context. So we think that information training will play an important role in the regulation, and also consistent with what has been previously said. We are dealing with a very complex architecture of determinants, so it's very important to put the digital and screen issues within a global package of a program acting on the other determinant. Today we have developed, during this panel, we have developed concerns about the negative impact of using screens and social media, but we also have to look on the opportunity to use this digitalization on a more positive way. We have an experiment in France using digital robots that are able to detect harmful content or suicide-related content in the within the communication, within the message that are detected in this social media. And this robot automatically deliver suicide prevention messages and suicide prevention resources. So it's like someone being part of the discussion, but with intervention with helpful information content. So we also have to look at how these social media can be used because these are very powerful in terms of message delivery, can be used for prevention strategies.
Okay, so again, looking at it as part of a solution, but also perhaps instead focusing a bit more again on the education and seeing how we could use this as a positive tool. Before we go to Q&A, anybody wants to comment more on the social media ban discourse? Just because again, it has really, I think, taken hold in Brussels.
Yeah,
Katja?
I feel like there's so many things that we could do, right? Some of them are really easy to do and really easy to implement. Others are like long-term, you know, creating those community-based services, making sure that there's the workforce to support young people, et cetera, et cetera. But there are easy things. So one of those things is the bell-to-bell smartphone restriction in schools. It's incredibly easy, it's cheap. I don't think we need tons of expert panels or conversations or consultations about, it's just common sense that it's not good to have a machine that is super distractive during school hours. Like, what's the benefit? Nothing. So let's just do it. It works like a dream. I can also speak from a personal experience. In Belgium, there's also in both language communities now this in place, but schools were obviously experimenting and having their own rules already before. So what teachers are saying, like before, when it was like on the teacher to collect the phones, to keep them, then somebody's phone was lost, and still they had their phones during breaks, which teachers are saying it's still disrupted, even if they put it away for the lesson, because in break time they were still on their phones. And so that carries over to the classroom. Now it's like in the morning, it's only an investment of like 15 euro, these kind of lock bags, what my daughter has. Put it in, lock it in, and you have machines to open them when the bell goes. Nothing complicated, just do it. And then you have obviously the more complex things like implementation of the Digital Services Act and also the AI Act. We haven't talked about AI actually in this context, which is also a really important conversation. So of course these need a much more resources and efforts, but there are simple things that we can do and just do it.
Yeah, thank you. I think a call, for quick action too. Obviously, there is a need to do the right research and assemble the panels, like you said, but maybe there are some things that can be done right away. Yes, if you can, very briefly, so that we can see if the audience has any questions.
Okay, just to say that there's also the plan against cyberbullying coming up, for which we actually consulted something like 6,000 children, because we note that the young people also are harming each other using social media, and that is also something to be addressed.
Yeah, definitely. It's both the addictive design of it, but also the content that's harmful often. Okay, we'll see if anybody has any questions. Yes, I see a hand over there. If you can just introduce yourself and then say your questions and who is it for.
Good afternoon. I'm Alina Denova. I'm representing a company called Signify, which is the lighting leader. And I was very happy to hear about the circadian rhythms that it was considered in the study. That's super cool. But my question is actually, how can we empower parents and schools to deploy all this upcoming regulations, or even the simple things that like were explained here with the simple smartphone ban out of the class, or, because it goes much deeper, right? So it's also not only about smartphones and social media, but in fact, schools are deploying digital programs. The learning processes are mostly now being digitalized. AI is now indeed being misused quite often, and kids are just, instead of doing, for example, essays themselves, they actually copy paste. So it's a huge discussion, I guess, in the whole education X course. And I think the key question is, how do we help and empower parents and schools in the end, universities as well, where these are the places, because we mainly, especially in schools, we're talking about, let's say, kids that are being taken care of, right? So in case of tobacco, it's an adult that has to decide, but in case of a child cannot really decide and kind of not use cell phone, especially if the peers are doing, especially if the teacher has to deploy a digital framework. And also there are also personal differences. Some kids are ready to be maybe exposed to a certain extent while others are not yet. So it's a super complex question, but the key question is, how do we empower, again, the parents and schools and universities to actually deploy these policies? Let's say if we talk about circadian lighting, are our facilities really equipped with circadian lights, for example, and other topics? But like even simple Wi-Fi filtering, you almost need to establish IT department in a school to actually keep monitoring that kids are not logging in, not being exposed to harmful content and so on. So that's the question. Thanks.
Okay, thank you. Frank, sorry, did I see you raise your hand? Did you want to respond, or was I wrong? Maybe not. Sorry. Okay, not to put you on the spot. I thought you did. Anyone wants to take that?
Yeah, I think sure there's a role for that, but I don't know if any of you have children in a public school and you know what kind of pressure they're under. And I think that's, these programs are great, but they can't be like on top of what the teachers and the schools are already dealing with. I think it really has to be integrated into the curriculum. The same way as I think now we're much better around like misinformation, for example, and that this is already part of what the kids are taught at school, like how to be critical about sources and etc. This should also be part of the curriculum, not on top another program, another organization that's invited to do this and that, and the teachers have to take it on. It's just not going to work like that. But to really make sure that it's in the IT department, like you say, that it's integrated in that. It's in the conversations, it's in the curriculum, that you have a module. So I think that's the only way, because it can't be on top of everything else.
Yeah, I mean, obviously at the same time, for the educators, there needs to be given the tools as well, and so be helped themselves to, recognize when there are possible signs, or knowing what sort of support, professional support might exist for teachers. It cannot be the problem of the teacher, but if those are supported in terms of tools, knowing where to go to, having more integration between the health and education systems, for parents themselves, education of parents, that could be, things which are done in school, but it can be also national messages, communications, going into schools in areas which are particularly more problematic, or things like that. Or even, I'm thinking I live in France, there is something that children need to pass, a sort of security related to walking on the streets, or crossing the lights, and security routière is called. It's something that they need to pass. Why not having something that requires all the children to have a sort of passing some minimum level of security in using digital tools? At something which is required as part of their own curriculum as well. Why we focus only on the physical harm that you might have from learning the rules about crossing streets, and not about these other type of dangers. I mean, it's just some of the ideas, but clearly it requires, again, this integration. It cannot just be told it's the teacher that need to do it, and it cannot be told it's just the health professional. Somehow we need to bring those two together, and keep the teachers, as well as giving the opportunities for the health professionals to reach out in school and be present there.
May I add something?
Yeah, of course.
Okay, just another consideration, another aspect we may consider is that we discovered that in several surveys in France that sleep problems are very prevalent. We have about 60% of the adult population who struggle with sleep problems. So we also may consider these impact on circadian rhythm in kids using overusing screens, that it should be embedded in a sleep strategy, in a national sleep strategy. That's why we also have a sleep roadmap, because adults should be informed, but also should incorporate some tools to improve their sleep and their circadian rhythm, and this will also have an effect on kids. So it's a massive problem. It's not only kids overusing screens.
Yeah. Thank you, Frank. Your image is frozen, but are you back on? Oh, but we could hear you, so that was great. Thank you so much. Do we have one last question? We have time for one more. Thank you over there. If you could keep it short, thank you.
Thank you. I'm from Sweden and the Swedish Product Medical Agency. And I was wondering about the DSA, because we have worked with it a lot about e-commercial and medical products that are not appropriate to have on big websites, for example, Facebook and so on. And I think when you're feeling ill, you go to internet and find a solution, and then you buy something that's not healthy. And platforms earn a lot of money on this behavior. Is the DSA the solution to this, or what should we do about it?
Perhaps Stefan, I don't know.
Yeah, we will see. I'm not really qualified to answer that question. But it is clear that the DSA is very new, and it will have to be reviewed. And of course, this will be done with input from everybody. And then it needs to be, well, we will see what kind of consequences it will have. But it will just be part of the general approach where everything will be evaluated, and there will be, of course, a lot of concern about those things which are particularly new. Yeah, it's very difficult to project or estimate what the result will be.
Yeah. Anyone else want to add something to this?
It's also, I think, the digital fairness framework that's coming up now that addresses a lot of those things about also deceitful marketing and dark patterns in getting people to buy things, and it does have that link with mental health as well, obviously. So really great that you have your eyes on that aspect as well. So hopefully that framework will also bring a bit more solutions.
Great. Thank you so much. This was all the time that we have today, but thank you for the speakers here, Frank online. Stay seated if you're in the audience. Our Master of Ceremony is coming back before lunch, but yeah, otherwise, please, round of applause for our panelists. Thank you. Thank you. You come out.
Thank you so much to all of our speakers, moderators, and to you, our audience, for a morning full of futuristic insights and also raw and just timely, relatable things like Kadri talking about feeling like it's a second job to monitor, keep your kids safe on the internet. I think we can all relate to that. And certainly a call for policy action. Thanks again to our leading partners, AstraZeneca, Haleon, MedTech Europe, and Sanofi, and to the presenting partners, FPA, Johnson & Johnson, Lilly, and Sandoz. With that, I'd like to invite my co-MC, Helen Collis, back to the stage. Let's give her a round of applause. So Helen, what have we learned this morning?
Hi, Sarah. Well, we've covered a lot of ground this morning, but we started with Belgium's Deputy Prime Minister and Health Minister, Frank van den Broek. He came out pretty strong with some comments on the Critical Medicines Act, showing we might see quite strong, potentially a fight on some of the measures in the Act from Belgium, at least, in the Council. He was also pretty strong on the long-term funding strategy for Europe and how we really need to have a public health arm ring-fenced for public health measures. But he was also pretty strong on non-communicable diseases as well, and announced this morning that Belgium is looking to ban flavoured vapes, like the Dutch have done. We had a great discussion on AI in healthcare, heard some of the key challenges in developing, but also adopting AI in healthcare. And one line that really struck me was that out of more than 6,000 hospitals, only around half of them are really using it at the moment. And we also heard from Rory's panel about the real wealth of expertise in innovation in Europe. It was a very positive panel in that regard, but there are real problems getting this innovation from academia, from biotechs, really into the health systems. And among those challenges is really upskilling people to be able to adopt the AI that we were talking about in the previous panel, but also new medical technologies as well. And finally, we just had our panel on mental health for young people, which I thought was really fascinating. Also that there was already a downward trajectory in mental health among young people before COVID, and that isn't recovering. So there's a lot of work happening here at the EU and at the national level, which is promising. But also we're seeing real movement nationally, in France at least as well, and in the EU to take action potentially on the use of social media among young people. But it's more complicated than that. We've talked about sleep disruption, diet, social determinants of health, which are also impacting young people's mental health. So yeah, we've covered a lot of ground.
Okay, well, let's go indulge our diet at lunch now. We'll break, enjoy your meal, have some good networking conversations. I'll meet you right back here at 2 o'clock for the afternoon program. That will start off with a transatlantic news briefing, a specialty of Politico. See you soon.
Thank you.